According to recent studies, Millennials and Gen Xers are showing a significant rise in cancer rates compared to older generations. A study published in July 2024 in Lancet Public Health found that Gen X and Millennials are more likely to be diagnosed with 17 types of cancer, including 9 that had been declining in older adults. What is happening in these generations can be considered a bellwether for future cancer trends, said Hyuna Sung, a cancer epidemiologist at the American Cancer Society, who led the research. This video will look at what cancers are on the rise and the potential causes that have been making headlines lately, and it's one we can't afford to ignore. We're about to explore the 17 cancer types identified in the study, contributing factors, the 10 cancers associated with obesity, and how these generations can better protect themselves. Let's start with some eye-opening numbers. The rates have doubled or even tripled for those born after 1990 compared to those born in 1955. Chapter number 1. Identified cancers on the rise in Millennials and Generation X. These cancers are: number 1, breast cancer, estrogen receptor positive. Number 2, pancreatic cancer. Number 3, kidney cancer. Number 4, small intestinal cancer. Number 5, liver cancer in females. Number 6, uterine corpus cancer. Number 7, colorectal cancer. Number 8, non-cardiogastric cancer. Number 9, gallbladder cancer. Number 10, ovarian cancer. Number 11, testicular cancer. Number 12, anal cancer in males. Number 13, Kaposi sarcoma in males. Number 14, thyroid cancer. Number 15, prostate cancer. Number 16, leukemia. Number 17, non-Hodgkin lymphoma. In the study, a team of researchers analyzed data from over 23 million cancer diagnoses between 2000 and 2019. Chapter number 2, contributing factors. Scientists have identified several contributing factors that could explain this increase. Poor diets and processed foods. Higher consumption of processed foods like red meats and sugary drinks are associated with obesity and inflammation, both of which can increase cancer risk. Diets low in fruits, vegetables, and fiber may also contribute to cancers like colorectal and gastric cancer. Obesity and sedentary lifestyles. Rising obesity rates are linked to an increased risk of many cancers, including breast, colorectal, pancreatic, and kidney cancers. Millennials and Gen Xers are facing obesity earlier in life, which extends exposure over a longer period. Increased alcohol consumption. Drinking alcohol, especially at young ages, is linked to a higher risk of cancers such as breast, colorectal, and liver cancer. Heavy drinking is on the rise in these generations, which could contribute to early onset cancers. Environmental exposures. Millennials and Gen Xers are exposed to more environmental pollutants, chemicals in personal care products, and other toxins that may contribute to cancer. Chemicals like BPA, often found in plastics, and endocrine disruptors are associated with hormone-related cancers. Sedentary screen-centric lifestyles. Increased time spent on screens and sedentary lifestyles contribute to lower physical activity levels, which can raise cancer risk factors like obesity and inflammation. Delayed childbearing and hormonal factors. Later pregnancies or opting not to have children, as well as prolonged use of hormonal birth control, can alter hormone exposure, which is linked to higher risks of breast, endometrial, and ovarian cancers. Chapter number 3. Cancers associated with obesity have been linked to a higher risk of several types of cancer. Here are 10 cancers associated with obesity. Breast cancer, postmenopausal. Excess body fat can increase estrogen levels, which is linked to higher risk of breast cancer in postmenopausal women. Colorectal cancer. Obesity is associated with chronic inflammation and insulin resistance, which can promote cell growth in the colon. Endometrial, uterine cancer. Increased estrogen from fat tissue can heighten the risk of endometrial cancer. Kidney cancer. Obesity may increase insulin levels, which in turn stimulates cell growth, affecting the kidneys. Esophageal cancer. Acid reflux is more common in those with obesity, and chronic acid exposure can increase the risk of esophageal adenocarcinoma. Pancreatic cancer. Obesity can lead to insulin resistance and inflammation, which can promote pancreatic cancer growth. Liver cancer. Non-alcoholic fatty liver disease, often associated with obesity, increases the risk of liver cancer. Ovarian cancer. Excess body fat can increase inflammation and estrogen levels, contributing to ovarian cancer risk. Gallbladder cancer. Obesity raises the risk of gallstones, which can irritate the gallbladder and contribute to cancer. Thyroid cancer. Obesity's impact on hormones and metabolism is thought to play a role in the development of thyroid cancer. Chapter number 4. Practical steps to reduce cancer risk. Step number 1. See your doctor regularly. Annual checkups are crucial for early detection. Step number 2. Know your family history. Understanding your genetic risk can help tailor your screening needs. Consider genetic testing. If you have a strong family history of cancer, talk to your doctor about this option. Step number 3. Get vaccinated. The HPV vaccine can prevent several types of cancer, and it's recommended for people up to age 26. Step number 4. Stay on top of screenings. Different cancers have different screening ages, so make sure you're up to date. Step number 5. Eat a healthy diet. Focus on colorful fruits and vegetables, lean proteins, and whole grains. Step number 6. Avoid tobacco and limit alcohol. These are major risk factors for many cancers. Step number 7. Get moving. Regular physical activity can significantly reduce your cancer risk. Step number 8. Protect your skin. Don't forget the sunscreen and protective clothing when you're outdoors. I know this might all seem overwhelming, but knowledge is power. By being aware and taking action, we can make a real difference in our health outcomes. Let's commit to taking care of ourselves, spreading awareness, and supporting each other in living healthier lives. Because together, we can face this challenge head-on and come out stronger. Thanks for tuning in to this important educational video. If you found this video helpful, don't forget to like, share, and subscribe for more health-related content from Health Equals Wellness.